Hello and welcome to this afternoon's webinar as part of the UCD School of Nursing, Midwifery and Health Systems Health and Wellbeing Research Series. So my name is Thilo Kroll, and before I introduce our speakers for this afternoon, I would like to say a few words about the practicalities for this afternoon. So the webinar is scheduled to run for approximately 60 minutes in total, and if we finish early, that's absolutely fine and okay. So importantly, I think we're not going to use cameras, and you will see the slides advancing and hear the speakers talk. And the speakers will give their presentation, and afterwards we would like to invite you to ask any questions or make comments on what you've heard. And to do that, we'll ask you to please use the chat box for this purpose, and I will read out any questions so that the speakers can respond. This is just to make the process a bit easier. We are assisted this afternoon by our audiovisual expert, Mr. Justin Dawson, who will provide assistance in case problems should arise. And I would also like to point out that we will record the presentation, so it will be available for later viewing. So now, without further delay, I'm delighted to introduce Dr. Anna Salzburg, who's a lecturer in film studies at the University of Dundee, and Dr. Jenna Breckenridge, a research fellow and occupational therapist at the University of Edinburgh. And they will be speaking today about care home as a cinematic community, enhancing social connectivity through film. The starting out point for this topic was the observation that many care home residents are passively positioned in front of TV screens in their care homes. And we asked the question really whether showing of classic films or films in care homes could be used in a more rewarding and beneficial experience to care home residents. So Anna and Jenna will now tell you a little bit more about the study and the specific details, and afterwards we hopefully have an engaged discussion on the topic. So I'm now handing over the presentation controls to Dundee and Edinburgh. Okay. So Anna and Jenna, if you want to start, please.
Okay, great. Thank you, Thilo. Thank you so much for having us. My name's Anna Salzburg, and I've got Jenna Breckenridge with me, of course. We're really glad to speak to you today about this project, Care Home as Cinematic Community, Enhancing Social Connectivity Through Film. This is the first project in the UK to explore the benefits of the film screening experience for care home residents. And it looks closely at the way that film has the capacity to enhance emotional well-being and social connectivity, not only between the residents themselves, who may experience loneliness and isolation from friends and family within the care home, but also the way that it increases social connectivity between the staff and the residents, who in large part organize the activity, or in some cases even take part in watching the film. So over 6 weeks, we went into 2 care homes, and we observed 3 screenings per care home, and we gave the residents a choice of films that they might like to view, and they ran between 80 and 90 minutes. Now we'll come to those specifics, of course, a bit later, but this project is happily interdisciplinary. So as Thilo said, I'm coming at this from a film studies perspective, and Jenna comes to this from occupational therapy. So we learned a lot in bridging those worlds. So we'd like to share some of those points with you today, and the main points from these, we're going to be drawing from some of the data and focus group interviews that we held to explore specifically how Golden Age musicals and comedies evoked residents' memories of past cinema going, but at the same time, the way that those films heightened their experience of the present, because so often we think about films in care homes as a sort of tool of reminiscence work, but what we really found enhanced the present tense, if you like. And we're going to sum things up at the end by talking about the potential challenges that were associated with the screenings, because in many ways the staff's motivation and their response to the idea of film screenings really determined how the residents enjoyed the screening, enjoyed the film. So we will talk a bit more about the staff response, and that's more to come. So I'm going to just pass things over to Jenna right now to talk a bit more about background information.
So we know that there are higher levels of loneliness in care homes, and studies have found that residents' contact with their friends and family declines by half after moving into a care home. Residents might experience lack of social interaction, may have limited meaningful contact with other residents, and that this is really affected by inflexible care home routines. There may be insufficient emotional connection between staff and residents, and these things contribute to kind of emotional and cognitive health impacts, so increase in depression and cognitive decline, and impacts on reduced quality of life. There was quite a comprehensive study of quality of life in care homes that concluded that residents who don't have pleasurable activities were more likely to die or report depression after 9 months following admission. There is evidence to suggest, though, that both active and passive participation in group activities can have a positive impact on residents' physical and emotional well-being. It can increase their feelings of social belonging. And different types of group activities have been explored in care homes and in the research literature. So, you know, the benefits of dance interventions, of reminiscence interventions, and horticultural therapy, gardening. And these have all been linked with greater social connectivity, improved mood, and reducing the experience of boredom. Now, there are some examples of using film-related materials in care home activities, specifically for people with dementia. So one project, for instance, featured a book of photographs of classic film stars as a means of kind of triggering engagement and discussion. Another study used a computer program that includes film clips and has a touchscreen format, so encouraging people with dementia to look at the things on screen and discuss it with their caregivers. However, other than these sort of film-related materials, the impact of actually engaging and watching a film and having film screenings with audiences in a care home remains underexplored. And so our study really tried to take up that mantle and explore that a bit further.
So part of our film studies approach to this, excuse me, taking this from kind of bringing the film studies structure to a health-related intervention, was bridging the worlds here with psychocinematics. So, excuse me, this is Arthur Shimomura's theory of a kind of conceptual framework to study the cognitive responses of viewers to a film as that film reflects the intentions of a given filmmaker. So I'll just break down the model. We used this in order to frame our observations of the overall 6 screenings. So our observational data was gathered according to this structure here, and we also used the structure to guide our interviews, our focus group interviews, after the fact. So again, here Shimomura starts out with the idea of an intention, so the director's point of view, or even we could push this further and say kind of genre. Is this meant to be a musical or a comedy? What is the main purpose in the entertainment here? And then the remainder of these factors, sensations, knowledge, emotions, deal with the spectator's response. So we can think about the sensory impact of the films, and then this element of knowledge, how it relates to stars, genres, or even personal cinematic experiences. So knowledge here, for our purposes, related very strongly to memory, what the residents knew of the films, what they remembered of the films or the stars. And then, of course, emotions. Do the films evoke happiness, sadness, excitement? Where we kind of pushed the structure even further was adding the idea of the social. So what we wanted to know was what the impact was of watching films in a group setting and how that group setting would enhance those elements that Shimomura identified. So again, we looked at 2 privately run care homes in central Scotland, and what linked these homes was they both featured very immersive screenings for residents. So they would draw blackout curtains and serve refreshments to try to approximate the experience as you would find it in actual cinema, as one home director said. So again, we ran these films, 3 films per home, and they ran about 80 to 90 minutes long. And the films that were selected by the residents, because we would bring in a choice of about 3 each week, were musicals. By and large, these were musical comedies. The choice of films, the idea of having a choice, was something that was very important for us and something that really, I think, benefited the entire experience. Because as one staff member said, the ladies have been looking forward to the film they were watching. It's nice to give them that opportunity to make them feel that they're getting the choice. Again, as the staff member pointed out, these residents are at a stage in their life where choices are, in many cases, being made for them. Now, you may wonder why it was solely classic films, because we had heard from activities coordinators beforehand, oh yes, the ladies love Bridget Jones's Diary, etc., more contemporary films. But when we offered residents the choice, what they wanted to see were the classic films. So we showed, in one care home, this is Care Home A, we showed You Were Never Lovelier, a Fred Astaire and Rita Hayworth musical, and then a Doris Day and Rock Hudson comedy, Send Me No Flowers, from the 1960s. And then we wrapped things up with a Betty Grable and Carmen Miranda film, Down Argentine Way. And what's interesting to note, again, bringing back this idea of contemporary versus classic films, was, again, this sort of, I guess, the juxtaposition between what you hear from more senior levels of staff, for example, the home director, where the staff on the ground, if you like, who actually would facilitate the screenings, pointed out that contemporary films really weren't that popular because, as she said here, we've tried to show contemporary films, and unless they're familiar, my personal feeling is they don't stay to watch the films because they can't concentrate to follow the story. It's got to be a story that they've actually seen previously, like if it had Fred Astaire and Rita Hayworth, because it's easier for them to follow. It's a movie that's familiar to them. And so, again, this brings us back to the knowledge factor, the importance of the sense of the familiar, what the residents knew and remembered of the films. Also, something that came out in interviews after the fact was that the residents really did assure us that what they wanted to see were films from, as one respondent said, from when they were young. So in one interview, we had a couple of responses. For example, I think the film means something to us personally because of its age. And yes, these are things that recall, that bring back memories from back then as opposed to up-to-date memories. I think one of the things that Jenna and I talked about was the way that the films looked and how that kind of Technicolor and in Technicolor, black and white, how the cinematography of the day seemed to have a sensory impact, seemed to bring back a sensory recollection for the residents as well. And again, as thinking about that juxtaposition between classic and contemporary films, as one respondent said, I think we've got to remember that films have all changed. The form of film has changed, and in some, and that's why I don't go to the pictures anymore. So it would be easy to think that the allure of these films was that it was all based in the past, which would in effect be positive enough. But as Jenna is going to discuss, what we found was that during the screening, there was a very striking sensory impact.
So film is used, I mean, anecdotally what we hear from care home staff, really film is used in order to promote reminiscence, and reminiscence has been something that is very popular, has become very popular. And the films undoubtedly played an important role in that for the people that took part in our study. But what we really want to emphasize and what our findings highlight is that film is about more than just remembering the past. It's also about enhancing the present. And that ties in with the notion that film is an embodied experience, we don't just appreciate it with our brains, but with our bodies too. So we noticed and observed how the residents and staff members would clap their hands, tap their feet, sing along with the numbers that they knew, and we even had some people getting up and physically dancing. And this just wasn't for the musical comedies where there was music and dancing, but also in Send Me No Flowers, which uses quite a lot of broad physical comedy and physical humour. That evoked a similar response. So the residents would lean forward in particularly exciting parts. They would lean back quickly as they reacted to something on screen. It was as if they were getting themselves closer to the screen to maximise their own responses to what they saw. And that physical comedy is really important, particularly for people with dementia who maybe cannot understand or interpret jokes that are told verbally and that rely on that cognitive response. But to communicate and respond to jokes through gesture and through body language rather than words is really important. So the quote here we've got from one of the focus groups when somebody got up to dance and we're asking the other residents, did they fancy dancing as well? And someone's saying here, it takes all your willpower to stay in your armchair and not jump up, and talking about the joy of dancing. And what I think that really challenges is that film is not necessarily a static activity. It's actually a vehicle towards promoting physical activity as well. It's not just sitting and watching a film, but there is that embodied response and the opportunity to get up. The quotation on the screen here gives an example of how the audience members are realizing that one of the women, one of the residents who's watching the film, has a bit of a likeness to Doris Day. And we really started to realize that actually the films enabled people to reflect on the changes in their own bodies and how their bodies are at this point in time. And when you think about moving into a care home and relinquishing control over your body in a sense in terms of, you know, your personal care and your choices over what to wear and what to do, to actually be able to use film as something that stimulates a connection with your own body again is really important. That also brought in opportunities for intergenerational learning. So Anna and I are both in our 30s, and we were engaging with residents who were a lot older than us. But this sort of comparing and looking at the film stars on screen about their fashions, their hairstyles and so on, struck up a lot of conversation between ourselves and the residents about what fashions were like now, about how fashions changed. They were able to pass on advice to us as women about dieting, about the way that you look, about not getting bogged down too much in appearance. So there was that real opportunity for shared learning. The other thing that we really noticed was that the structure of musicals was particularly well suited to the variety of cognitive ability of the residents in the room. So we were often told by the staff, oh, I wouldn't bother trying to put anything on that's very long because nobody will pay attention. The structure of musicals, though, being quite musically driven rather than dialogue driven, meant that any time there was a bit of dialogue that some people weren't following, as soon as that had passed, 10 minutes or so, another musical number would start and any wandering attentions would be right back on the screen and reset. And this is one of the staff members recognizing that. She says, yes, I noticed that there was recognition again. Since we viewed the film, and a few ladies have actually talked about it afterwards, so there's been something about the film that has connected with them. And despite the fact that they were perhaps not able to attend cognitively to the film the whole time, the memory, the experience, the mood, and the particular stars has lasted with them so that they were actually able to talk about it afterwards. And it's this power of film to change mood as well, which is really important. So even if you're not able to necessarily follow all the intricacies of the dialogue, the residents were still getting a sense of achievement. of mood. You Were Never Lovelier is a really good example of that, because it's a classic love story. The boy meets girl, they start to fall in love, there's a complication, and then they come back together at the end. And Fred Astaire literally arrives as a knight in shining armour at the end. And we observed that residents who had lost attention throughout the film, who'd fallen asleep, just in even seeing that image, it uplifted their moods, and it was a sense of having achieved and finished the narrative, which was really important.
I think that as well, something to bridge along with what Jenna was talking about here is the staff investment, where, as Jenna just read the quote about the staff acknowledging, yes, okay, there must be something positive happening here with these films because of all of the social engagement, all of the kind of cognitive responses that these films were evoking. And here on this slide, you know, there's the quality of the mood, because as you can see, the staff member was speaking about a kind of difficult resident, quote unquote difficult resident, and she says, we've had a few issues with her behavior this week, and I'm seeing that through the power of television here, or film, but of course we're watching the films on television, on a television, that this individual is back to being the individual as they knew her to be. So that kind of acknowledgement, which was, you know, really terrific for us to see on the part of the staff, was overall, we don't want to say begrudging, but there is a kind of, it's something that we would like to develop in the future, is really working on staff investment and engagement with films as a meaningful activity. And so for this sort of phase of the paper, I've got a great, well, it's an interesting quote here. Would you like to have a party with music and dancing, or would you like to finish watching the film? Which was literally the choice that was given to a group of residents as they were watching a film, because the staff member was so preoccupied with the fear that the residents were, quote unquote, losing interest, or that their attention was wandering. So I'll come back to this quote in a minute, but it does kind of capture the interesting dilemma here of where does film fit in terms of the sort of hierarchy of activities. So again, we went into 2 privately run homes, and these were considered research-ready homes, and there were refreshments served in each home throughout the film by staff members. There was also a very strong gatekeeping presence in the form of a social organizer. And now I'm speaking specifically about the second home that we went to. The homes shared both homes had a kind of reticence to the duration of the film. They were very wary of just letting the film run in its form, because again, there was the idea that no, the attention will wander after 30 minutes. You'll never get the residents to pay attention for longer than 30 minutes, which was really not the case. So, you know, we did get one staff member did give us, again, this kind of begrudging acknowledgement. She said, I'll be very truthful. The last 2 films where I felt like, oh gosh, this is not working, but I'm totally on the fence today. I can really see that there's just the right film for the right time. It's just being lucky and getting everybody at the right time, in the right place, in the right film, and it changes so much. Now, certainly, there is always so much to be said for contingency, but, you know, we want to point out that Jenna's and my observations about the residents' enjoyments of the film was largely the same across the weeks and across both homes, as were their comments in the focus group. But when we spoke to, again, coming back to the second home, when we spoke to a staff member about how frequently they used films as a means of entertainment or a means of activities, the staff member said, yeah, I offer them one once a week, but as I say, it's not a long film. It's usually for half an hour as a short comedy film, and they're quite happy with that. So, but of course that was, she was speaking here about an episode of Steptoe and Son, which is not a film, it's a television series. And so there was an intrinsic resistance to feature films and this sort of complacency that, oh, that's fine. Look, they're happy with a 30-minute film. And yet the residents responded very positively to the longer films when Jenna and I observed them, and also to the choice, having the choice. I mean, if all the residents know is that Steptoe and Son is the option, well, that's certainly going to limit their experience or their association with film itself. Because, again, the overarching issue is the fear of the residents not paying attention. And so one thing that Jenna and I were very keen on putting forth is that there's no right way to watch the film, and that there was a level of expectation for the spectators that the residents needed to essentially, if they spoke to their friends or acted at all distracted in any way, one staff member came up to us and said, well, they're not paying attention now, should we just stop the film? But by the same token, going back to this original slide here, the choice was given to the residents in the middle of a film. Would you like to have a party with music or dancing, or would you like to finish watching the film? So in a way, we found that the deck was stacked against the film screening in this particular instance, where it was seeming to where another activity, like a birthday party, would take precedence because film wasn't necessarily perceived as a meaningful activity. But Jenna's going to take it away in a moment to talk about our future steps with this, but to sum up what we found overall, where we are now, is that, coming back to this Shimamura model of psychocinematics, that it was the popularity of Golden Age musicals which evoked the high sensory impact, singing along, moving in your seats, getting up to dance on the part of the residents, which as well at the same time catered to this knowledge of stars, of familiar songs from their youth, but also the look of the film. All of these elements really conspired to give a positive response, largely this greater sense as well of social connectedness, sharing the responses, sharing the moods, the memories, but also, as Jenna said, the enjoyment of the present moment with those around you. It wasn't solely about reminiscence by any stretch. It was enormously about engaging with each other, about the film that they had just watched, and again, as Jenna said, engaging with us as kind of from another generation, this process of intergenerational learning. And one thing that really, this is probably certainly one of our favorite quotes from the focus group that I'll just close with here. One resident said, when you see some films like that, do you ever make any comparisons with your own life? Have you had as good a time as you see those people having on the screen, or sad days just the same as them? Life's a mix-up, isn't it? You have your good and your not so good times, and your fabulous times. And this resident was framing this really, this contemplative response in relation to the screening experience. And she was engaging with us about it, but also she perceived the film itself to be part of that community. She perceived the film itself to have a subjective identity that spoke to her and awoke something in her. So that's something that Jenna and I are very keen to keep in mind and pursue further, that idea of film itself as being part of that community. So in terms of future steps, I will just hand this over to Jenna.
So based on the research that we've done and future plans as we start together, I think what we've really realised is that there's a need to raise awareness of the use of films and to really promote the use of films within the care home environment and for people with dementia. And part of that, I think, is about challenging some of these attitudes that we came up against. So, going back to the beginning of our presentation, when I think Tilo had given the example of care home residents being passively sat around the TV, and actually the TV being something that's just on in the background and we're not engaging with it, getting away from seeing it as a passive activity to actually something that's meaningful. and thinking about how only watching half an hour of a film or 15 minutes of a film and not getting to that resolution, what that does in terms of compromising the meaningfulness of the activity. It's about challenging the idea and the dominant idea of reminiscence. And that's not to say reminiscence isn't important, but it's just to capitalize on the benefits of film in terms of enhancing the present, enhancing agency, enactment of agency, residents having choice and making choices, having control over what they do and their own bodies. And that's not necessarily just in choosing the film, but in how they choose to engage with it and the different types of spectatorship. It's challenging the notion that film is passive and that it requires you to be static, and introducing options for facilitating film rather than just having it on in the background and using that to promote physical activity. It's also challenging film as an individual activity and seeing it as something that can actually promote communication. So all of the interactions we observed in the residents, with the staff, with us during watching the film suggest that they promote a vehicle for communication, and that communication, importantly, is not just verbal. It's recognizing the embodiment, the embodiedness of communication, and encouraging communication through smiling, through slapping your knee, through nudging each other, jokes through gestures. And I think it poses some interesting challenges for how we maybe take forward work that looks at incorporating film within the inflexible environment of care homes, challenging the notion that the structure of films is more than just about length. Musicals, for example, we saw were able to bring back attention spans and so on, as opposed to perhaps something like Steptoe and Sons, which really doesn't have any of that because it's mostly verbal. So there are a lot of different avenues for us, and our future steps are we're continuing to have communication with a lot of care homes across Scotland and with particular bodies here, and planning to really take this work forward. So I hope that our kind of whirlwind description of a complex project has given you some sort of insight into that, and hopefully raised your awareness about the complexity of something so simple as sitting down and watching a film.
Thank you.
Thank you.
Thanks.
Well, thank you very much, Anna and Jenna. This was fascinating, and I still remember, I think, in the early days, sitting around a table and just pondering what this project could look like and would look like, but I wouldn't have, in my faintest dreams, imagined, this richness of ideas and findings, that came out of this. So I just want to open up for some comments and questions. I know we have already two, so they're quite concrete. So one is around this notion of, if people thought back to the first time they perhaps watched that film at an earlier stage in their life, did they express that? Did they talk about it? That they reminisced about, what life looked like back then and the circumstances of their lives when they first maybe saw one of these films that you mentioned?
Yeah, they definitely did. We had a lot of fun conversations about going on dates to the cinema and holding hands and kissing up the back, and realised that was definitely an intergenerational experience. So yeah, definitely there was quite a bit of reminiscing about that. And what was really interesting to us as well was that reminiscing and thinking back to when you first saw that film could be something that was really fun to remember, but it could also be really difficult. So we had one lady in a care home who told us about the first time she'd seen one of the films, and it was a happy experience for her. She remembered going to the cinema with her aunt and her dad and watching the film, and the memory itself was really positive and happy. But that soon quickly became quite difficult for her because she suddenly had this realization that the people who were so important to her at that time had now died, and she became quite upset in the discussion. And I think what that really raised for us is the notion that, yeah, the films could bring up memories of the time, they could bring up memories of going to the cinema and seeing them for the first time, but as facilitators of that, staff really need to be prepared to deal with sensitive emotions and to process them and talk them through. And that notion of having a happy memory, watching a happy film, could then bring up feelings of grief, and just being able to deal with that was really important.
And I guess the study brought that out as well, and the framework that you introduced is quite helpful in that regard, because it shows these different dimensions. And I think if you assume it's a passive activity and you just plunk people in front of a TV screen, and but you're not reflecting on the impact that the story or the momentary experience might have on them, then you probably wouldn't be able to respond to that very well. So you probably don't even understand the relational characteristic or relational character of the film viewing experience. So if the material that's being presented and the spectator engaging with it. So I think it's quite helpful to and that's another, I guess, byproduct of the study, is to illustrate what might be happening actually on a day-to-day basis in care homes, but what is not being picked up potentially or not responded to maybe in a particular way. Another question, is around sort of repetition. How important is repetition? You mentioned Step 2 and Son. So that's probably a TV series that has been shown, repeatedly on TV. And similarly, I guess some of the classic films. How important is the notion of seeing the same kind of film over and over? Did they comment on that?
I think that it wasn't so much. It's funny because we framed it, as you say, repetition is in a sense what we're talking about. What we really connected this to was that knowledge factor and the sense of having. I think there was a sense of pleasure in recognizing something and in being in having that access to that knowledge of your own past cinematic experience, but also the your knowledge of the stars, of the songs, the films themselves. At the same time, I think that was part of the appeal of the choice, the idea of choosing the films to avoid perhaps running over the same ground, because what Jenna and I both picked up on in both homes was that there were enormous DVD collections, and yet when we interviewed the staff and asked them, what do you show, we kept hearing the same films. So in other words, these films were just waiting to be shown, and the great, all the variety of these types of films, these classic Hollywood films, and they weren't being explored. It wasn't being taken advantage of. So it's having a resource there that is just kind of lying, it's just not being taken advantage of, which would, I think, introduce a whole other element of variation and kind of fluidity to the experience of watching films, rather than having it be, we're all going to sit down in the lounge again, and here goes Step 2 and Son, So
it's funny, we asked in one of the focus groups, we said, what kind of films do you like? And one of the women in the focus group said, I can't remember what kind of films I would like. And so I think what that suggests is it puts quite a bit of onus on staff to be creative in terms of the choices that they offer. So we got really positive results when we had a smallish selection of different films and different stars that we could talk through, and then people made their preference there. And so really I think it's about not sort of assuming that, everybody loves Step 2 and Son, we get a good response every time, so let's just do the same thing. but then maybe trying to facilitate choice and bring in more options. And that really is, it's the staff's responsibility there to do that. Actually, the staff in the care homes hadn't seen any of the films that we showed and ended up really enjoying them themselves.
Yeah.
Mm-hmm. Yeah. And I guess that that's really really important. I mean, a number of issues. I mean, one around the staff preparedness and training, but then the other thing around these two care homes, and you basically looked into two similar but yet distinct environments. Maybe you could comment a little bit on that. What maybe made the experiences very different in one care home compared to the other, and what the similarities might have been between the two.
I think that in the instance, the first thing that came to my mind, and psychically, I bet Jenna felt the same way, was the fact that I use the word begrudging a lot, which makes me sound kind of cranky. But in the first of the care homes, we had a social coordinator who was very benign in her approach to the project. I mean, she facilitated it for us. Got the residents in. It was very, very lovely about it and very responsive to the project, even if she didn't necessarily, believe it, quote unquote. And that made that project, that phase of the project very positive. In the second home, we had a social coordinator who was very much a non-believer. And so we did feel that we were coming up against a more active opposition, frankly, in terms of the importance of the project and how the project was being perceived by that member of staff. So, as you say, although there was parity in terms of the homes privately run, research ready, and again, really positive, lovely facilities, it was the attitude on the part of the staff that it determined the results that we had, and certainly our response to the homes themselves and how film was being viewed there.
And it's an interesting experience, I think, from a research perspective, because like negotiating our way into these homes, and when we visited the homes and fed back to them. And what became really clear was that at management level, the care home managers were so enthusiastic and really had that sort of much more open value of research and the work that we were trying to do. And really the way in which they talked about residents, that the care home was their home and enabling choice and variety of activities, that was a very strong message from the top. When we were working there doing the screenings, and we were with the activities coordinators and some of the other care staff who were around, I think there was maybe just a bit of a lack of understanding of what it was that we were trying to achieve. And there was also a real priority, I guess, as there should be on everybody's minds about just trying to make sure that people got their medication on time and that they got their dinner on time and that care home routine was maintained. So, it's definitely a bit of a lesson in terms of care home work and about how you lay the groundwork for going in. And at management level, you're getting one kind of picture, and that's very responsive. But then when you're actually in, just the importance of building relationship with the staff. And in the first care home, where the activities coordinator wasn't too fussed, really, she was very helpful, but she had no big hopes for the project. As that went over time, she really changed, and we developed quite a good relationship with her because she had that sort of openness. In the second home, it was quite chaotic, and the staff were less likely to participate. So in the first home, when we were showing the films, staff members came in and sat and watched the films with people and chatted to them about things, and they had an intergenerational learning and conversation. In the second home, we were in the room running the film, and the staff would just pop in every now and again to check everything was okay. So they didn't have that same degree of connectedness between residents and staff. And actually, it really shows, I think, in our data, that in order for film to be meaningful, it can't just be something that's left, it's just put on and people are left to get on with it. It needs to be a facilitated experience, and it's really probably just about working with care home staff to try and make sure that they have the skills, the opportunity, and then the capacity within care home routine to be able to do that kind of thing. And I mean, that's all sort of pragmatic stuff we would want to follow up in a bigger study.
Mm-hmm. No, that's really fascinating to to see this, and that's, I guess, in the title of the webinar, social connectivity and the intergenerational learning opportunities. I think that was a very strong element in the presentation, and it came out quite strongly in the findings. And so I'm just, and you gave, I wrote down while you were speaking a number of thoughts and ideas, and we talked about control, we talked about choice, we just talked about this element of social connectivity and opportunities for intergenerational connectivity, both between you as the researchers and the residents, but also between staff and the residents. But I think another element that struck me really very strongly is I think it's this notion of not pondering to the predominance of reminiscence and the cognition in that, but also looking at sort of the in the moment experience, the sensory impact, the emotional impact in the here and now, and which is could be also represented in concepts like flow, and the psychological concept of flow, being in the moment and the engaged, engrossed in an activity, and really forgetting, the here and now, and the perhaps the constraints of a care home, and perhaps the notion of not being at home, but sort of this notion of escaping into this moment for a moment to get a break from the realities of where the resident is at the moment. And another thing that I wrote down is, which is a bit slightly the opposite of that, is that the film might also open up a window to the world outside. If you're sort of confined in mobility terms, but also perhaps in your social terms, and by the fact you're at that stage in your life where you're perhaps more constrained in terms of your reach, that it opens you over time and space a window to the world outside. Just wonder if you have any comments or thoughts on that.
I think that's right. I mean, I think that's something very kindred to what that quote that we closed with, the idea of that resident who found herself a bit. The film made her ask herself and ask us, have you had days like that? Have you your good times and your not so good times? And so, yes, I mean, I think that's right. In a world, in an environment where you are seeing the same faces a number of times, and you are, as Jenna pointed out, these very inflexible routines, there must be something very liberating about seeing another, again, if you think about film as having a subjective identity, about meeting someone else and seeing film as someone else or something else that has been introduced into your environment. And it's not just a window to the past, but as you're saying, Thilo, this is another entity that has come into your environment to broaden it somehow. That it creates something very new and dynamic about what could potentially be a very static environment.
And Anna and I have had discussions as well about how, our seminar, I guess, is focused very much on a sort of health side of things and health, social science side of things. But, actually it's really shown that there's such potential for older people to be contributing to the field of film studies. Because we were really talking about how, watching these films we're going to have lost very soon a generation of people who actually lived through particular eras, who wore particular fashions, who and we learned a lot from the residents, actually, and that's something that really should be capitalised on, because we assume that somebody's older or somebody has dementia and therefore they have nothing more to give, when that's completely untrue. It's actually just about adapting the way in which we communicate and work with people. And I think there's a real sense and reminiscence, coming from an occupational therapy background, it's been something that has been focused on a lot, and it does have merit, but I think really what it risks is reducing people to their cognitive decline. It's pathologizing. The medical model has tried to sort of move away from just focusing on the body and the part that's wrong, and yet we're not really doing that with dementia. We continue to continuously focus on what people can remember and what they can't, and actually, embracing that, experiencing something in the here and now, and you might respond differently to it now. It maybe doesn't matter if you've seen it before and you can't remember, or you have seen it before but now you like it. I think we understand that people change throughout life, and yet when you get a diagnosis of dementia, you're not allowed to change anymore. You have to be the person with the same memories and the same chronological order. And so I think there is something really important about that, focusing in on the here and now, what people can contribute, what it gives to people, and that's not necessarily always about remembering.
Yeah, and I think I would agree with all that. You mentioned the importance of staff and staff preparation, and if you were to take this forward, what would be sort of maybe your key thoughts on what a staff training would have to entail? What would it incorporate? What are the key elements?
I think that's something that the future project will need to pick up. I mean, we have managed to, I guess we want to recognise that showing a film and facilitating watching a film will be individualised. It will be tailored to the setting. But what I think we can try and do with our research is to identify those core components that are not necessarily changeable. They're the key things that make film screening effective. And a lot of that will focus around about, yes, remembering the past, enhancing the present, setting up a physical environment that supports attending to the film. So, for example, it worked quite well when there was various physical cues. So we had shared popcorn and there was hot dogs, things like that, which really gave it a cinema-going experience. So when people did become quite disorientated, it was quite comforting to have those sorts of cues present and to be able to settle again. I think the aspects of facilitation that focus on non-verbal communication and using film as a communication tool, and part of that really will come from sort of understanding and unpicking what the key elements are of film watching and film watching together that have therapeutic benefit. And so in being able to unpick those kind of things, it will be possible to look at what type of facilitation actually operationalizes some of those benefits, but needs to be taken further before we can say conclusively.
So, I mean, I think that's clearly impetus for a lot of future work in this, both maybe replication studies, but also work that builds on this, perhaps towards an intervention study in settings that would clarify some of those issues around the training as well. So I think we're just about under an hour, and I think looking at the screen here, we have exhausted, I guess, the questions, and so I'm sure there are lots more. I mean, I have a whole list full of questions, but I think we can address them at a later stage. So I would like to just thank you again for this really exciting webinar. And I also like to thank Justin for his support, and also Aisling Jackman, who's not online at the moment, but who helped you to spread the word about the webinar and created posters and so on. And like I said, this will be archived, so we'll send out the link to attendees, but also via Twitter and other media soon. So, well, I'd like to draw this then to close, and thank you again for all your interesting contributions, also everyone who sent in questions. So thank you very much.
Well, thank you. Thank you, Thilo. Thank you, Justin and Aisling. Thank you.